there, welcome back to my YouTube channel. Thanks for watching. Thanks to everyone that's subscribed to the channel and is watching the videos. Please remember to click the notifications as well so that you get the latest video as it comes out. And also remember to like the videos here as well on the channel. There's also a playlist. If you check the playlist out, I'm hoping to fill that with lots of content from post-op carers, recovery houses, different talks with surgeons, things like that, anything really to do with cosmetic surgery. Today I'm going to be talking about wound care with a wound care specialist. Hi there, please introduce yourself and just tell me a little bit about what you do.
Hi, I'm Heather Flexer. I'm a doctor of physical therapy and a certified wound specialist. I'm based out of New York State in the US. Okay. And I run Better Wounds, which is basically a consultation service. So I find often that folks are out there trying to recover from their surgeries and their post-op care and all of that. And if you develop wounds, sometimes you don't know where to turn. So I offer an option to talk to a wound specialist.
Yeah, good. And so, yeah, so I just really wanted to get you on today. I'm quite interested in this topic as well. So I wanted to just ask you some basic questions about what people should do if they have a wound. So firstly, how would you know, say you've had surgery, say you've had a tummy tuck surgery or something like that, what is the first thing you need to look out for to know that you've actually even got a problem?
So the first problem, you're always looking for signs and symptoms of infection. So like redness that is more than about 1 centimeter on either side of that incision line. So if it starts spreading, that's a problem. Pain, a lot of drainage are all problems. And of course, if that incision line busts open. But one of the first things we see is that incision line starts to go really dark. So that like dark purple, it's starting to go black, like you're not really sure what's happening. That's really the first sign that you're not getting enough blood flow to the area. And it's really common because if you do a tummy tuck, they're taking, like if you had a large portion of skin and fat removed, the blood supply may not mesh up immediately. So all these things take into consideration, like how healthy you were to begin with, blood flow, diabetes, what your nutrition is like, all that can be like pending factors. And, you know, some surgeons are real sticklers about who they'll do surgery on and some aren't. And then some complications happen.
What is the, like the main kind of surgeries that you see wound issues with? Is it all surgeries or is one particular surgery more popular than the other?
Just the folks, I mean, anyone can be at risk to have complications. It could be like a hip or a knee. It doesn't have to be plastic surgery clients, but definitely the tummy tuck, the more skin they remove, you know, the more difficult it is. And then breast lifts seem to be like where the incision tends to meet, like where they take the two pieces and that meets with it, like right in the center, there always seems to be, like right under the breast, there seems to be a little bit of a problem. I don't know if it's the blood flow or if it's the pressure or the tension. So sometimes it's just a perfect storm.
Yeah.
You got lucky.
So, yeah. So tell me, say for example, if I've had surgery and my plastic surgeon is saying, oh no, it's fine, you know, maybe wait another week. In your opinion, at what point should you be kind of, you know, because, you know, I've heard of lots of people saying that, you know, their plastic surgeon has said it's fine. You know, at what point would you say to seek help, to seek like your kind of help?
I mean, right in the beginning, if you have an inkling that something is not right, but you're following the doctor's recommendations, like a week or two, you know, you're just kind of waiting and seeing, because some of this stuff will resolve. And that's like what they're not panicking either. Right.
Yeah.
They also think they can fix everything eventually. So they'll fix it in their minds, I think, is a little bit of what's happening. But if you have a wound that is open and not progressing and it's been 2 weeks, 3 weeks, it's time to get in touch with a certified wound specialist. And not all surgeons are specialists in wound care. So
that's what I was going to ask you.
Yeah, you do. It's not that they don't, I mean, they do surgery. I don't do surgery. I don't know how to do that. But they don't all know how to heal a wound complication. So some do and some don't. And you got to take that, initiative on your own to get in touch with a wound care specialist. I tell a lot of folks to Google wound clinic near me. I don't know if that's possible in every country, but whatever probably your resource is, like however it is that you can look up stuff, try to find a specialist that you can get in touch with. I wind up giving people like an interim option, like while you're trying to find your specialist, this is what I would say you should do from home. And then I try to give them like step-by-step instructions of how to manage at home.
Yeah, that's good. So just say I've heard lots of different ways that you should be caring for the wound after surgery. So, some people are showering the next day. Some people are told not to shower for 5 days or 10 days. In your opinion, should the wound be kept dry or wet, or, what would you be doing in general?
Well, first you start with the doctor's recommendations because they know you. They only know what they did to you and with you. Yeah. So follow the doctor's recommendations first. And then showering is usually okay as long as your incision is closed. Okay. And then you just want to let it air dry, kind of pat it dry with a clean towel. And if your incision is closed, no drainage, no nothing, you want to keep the wound dry. Once you start putting ointments and balms and salves, you run the risk of opening your wound up. And it's not ready for that. So you can't start using scar stuff until you're completely closed and healed. Okay, and that's where I see a lot of people starting to use scar stuff way too early. You can't treat the scar until the wound's healed.
Yeah. Another thing I wanted to ask as well, I've also heard of ladies having the wound open and it being stitched back closed. Now, I know for myself, I was told, no, that's definitely a no. It needs to heal from the inside out.
So do you mean their wound opened and then the doc went in and said, yeah. So usually that doesn't result in great results. If the wound, if there's bacteria or there was too much tension, all they're doing is
allowing it to come out.
It doesn't really work out so well. So more often than not, you're doing the healing from the bottom up and the outside in. So you're going to be packing the wound at that point. Okay, so you're doing wound care. And so at that point, you either need to be collaborating with somebody, getting some care somewhere to figure out what to do.
So then you're more than likely going to end up with a worse scar because it's not being closed back. Is that?
Not necessarily. Sometimes people will close up just fine. It's very popular in the States. If you wind up getting to a wound center, that they use more of the negative pressure wound therapy or the VACs to help close it faster than just packing. But the scar stuff, over time, it's going to fade anyway. And there's so many treatments that you can do to fade the scar as well. But stitching it closed may work, but oftentimes it opened for a reason and it's going to reopen.
Okay. So what are the signs that you look out for to, when you think, okay, I'm on the road to recovery? What are the signs that it's getting worse, and what are the signs that it's getting better? Is it just closing up, or?
Worse is always bigger, drains more, smells more. That's always worse, right?
Okay.
Better is just the opposite. The wound's getting smaller. You've gotten rid of dead tissue. So if you had yellow and black dead tissue in the wound bed itself, now it's pink and healthy looking. That's great. Less drainage always means it's improving, and it should start getting smaller. Like you expect the wound to get smaller.
Yeah. Okay. Are there any ointments or anything that you kind of recommend that someone has on hand or anything like that? Anything that you think that works really well?
Everything's different, so it really depends. You need to use the right product at the right time. So, and every country has different things available. So, but if you do have necrotic tissue, which means like it's not pink and healthy, it's that yellow, gooky, sluffy stuff, or it's black tissue, like from a lipo burn, you have to get through all of that to get to what's underneath. So sometimes like using the ointment makes people kind of panic because it looks wetter and goopier and drains more. And they're like, oh no, it's worse. And it's like, no, you got to get rid of all that stuff first. Yeah. So, if you're working with a physician, they can usually prescribe like an ointment for you that'll help enzymatically debride it. But otherwise, we're going to use some other over-the-counter ointments to help get rid of that. But as far as like one size fits all, that's why I always ask people to send me pictures, because I'll get someone that's like, hey, I've got this little black thing on my wound. Should I use this? And I'm like, please send a picture. And it's like this. I'm like, that's not little. Go to the urgent care.
Yeah. Brilliant. Okay, that's brilliant, Heather. So just kind of lastly, just tell me about what kind of you do and how people can go about getting your help, and what's the process to do that. What sort of help can you provide? Is it worldwide or is it just your area?
I'm welcome to offer like my opinion on whatever. So anyone can send me a picture. You can reach me at betterwounds.com. There's a little help button that pops up, and you can send me a picture through that. Or I'm all over Facebook or Instagram, and you can use Messenger and send me a picture. And then I'll basically just tell you, you're doing a good job, like keep going, or nope, we got to get on a video call because you're headed in the wrong direction. Or I really think you need to go to your ER or urgent care because you are looking at a serious issue. So that's usually what I do for folks. And then I have all sorts of options online, like nutrition plans and activity things people can do to kind of supplement everything together.
That's brilliant. Okay, that's good. So just lastly, just tell me a little bit more about what you do. I know it's not just wound care, you have other services as well. So just give us a...
Well, I'm a doctor of physical therapy, so I'm always going to recommend that you get out and get moving. A lot of times, you're sitting there recovering and you're like stressed and panicked about everything that's going on. And you really need to get you can't heal unless your body's like primed for it. So you need to get all your fluid in, you need to get your protein in, and you really need to get moving. Yeah. So that's another thing that I love to help people with. So if you're struggling with mobility or figuring out how to do all this stuff you need to do and heal, feel free. I'm here.
That's brilliant. Thanks a lot for talking to me today.
Yeah, have a great day. Thanks.
You
I
too.
appreciate it.
Bye.